So if we look at the SURPASS program, this is the phase 3 clinical development program for tirzepatide. It's important to note that it spans across the spectrum of patients with type 2 diabetes, from monotherapy, so patients only receiving tirzepatide versus placebo, which you see on the left, all the way to combination with basal insulin in patients who are failing or suboptimally controlled with basal insulin. And also importantly, there's an ongoing cardiovascular outcomes trial versus dulaglutide, which is expected to report out in 2024. So let's take a look at sort of some of the composite data from these trials. And what was shown across these studies in SURPASS 1 versus placebo, in SURPASS 2 versus semaglutide, so the selective GLP-1 receptor agonist, in SURPASS 3 versus the basal insulin degludec, in SURPASS 4 versus the basal insulin glargine, and in SURPASS 5, as I mentioned before, in patients already on basal insulin versus placebo. If we look at the reduction in hemoglobin A1C, we see significantly greater hemoglobin A1C reduction with the 3 doses of tirzepatide that were studied, 5, 10, and 50 milligrams, compared to placebo and compared to the active comparators in SURPASS 2, 3, and 4, again, including semaglutide in SURPASS 2. And with respect to proportion of patients achieving targets, very impressive. Patients in general reached A1Cs on average of 6 or less, with up to 90% of patients achieving A1Cs of less than 7%. And quite impressively, in some studies, close to 50 or slightly over 50% of patients achieving normoglycemia less than 5.7%. If we look at weight reduction, in each of these trials, the mean BMI was greater than 30. So on average, these were obese patients. And you see weight reduction either over the 40 or 52-week duration of these studies, and dose dependent when we look at the tirzepatide arms from 5 to 15 milligrams, so greater weight reduction with the greater doses, but you can see relative reductions in body weight, in some cases up to 14%. And as with A1C, always greater weight loss versus either placebo or the active comparators in these studies. And if we look at clinically relevant weight targets, so greater than or equal to 5% weight reduction, for example, we can see that up to 80% at the highest doses, so the 15 milligram tirzepatide dose, achieving greater than or equal to 5% weight loss, again, greater than what was seen with the comparators. And even a more stringent target, greater than or equal to 10%, reached by anywhere from 40 to almost 60% of the patients, depending on the clinical trial.